Hi, good afternoon. My name is Terika Thomas Mills, and I'm going to be performing the skill Foley insertion on a female patient. For remediation purposes, I am going to be starting this video from opening my kit and doing the Foley insertion. So I have already introduced myself to the patient. I have confirmed the patient's identity. I have explained the procedure to the patient. I have gotten the patient consent. So I'm gonna go ahead. I also have positioned the patient in I've positioned the patient in a position that's appropriate for the Foley insertion. I have raised the bed to a comfortable working height, and I am standing on the right side of the bed because I'm right-handed, and that's my dominant hand. So I'm gonna go ahead, I'm gonna perform hand hygiene. Okay, and I'm gonna open my kit. The patient is already laying with her legs ajar. So I am gonna go ahead and open my kit. I'm gonna place it in between the patient's leg, and then I'm gonna begin. So I have my Foley kit here. Take this back and I'm going to lay it at the side of the patient. I'm going to be using it for trash. Okay, so Miss Brown, remember you're going to keep your legs open for this procedure. So I'm going to go ahead and I'm going to open my Foley kit, opening each flap one at a time. And I'm only going to be holding onto the 1-inch margin. I'm going to open this side. I'm going to open this side, and then the side that's closest to me, I am going to open that last. So I am just going to move this back for a bit so that everything is going to be in proper view of the camera. Move this back. Okay. All right, let me just perform hand hygiene again. Okay, so now I'm gonna go ahead and I'm gonna apply my gloves. Let me just move this over until I'm done. Okay, so since I'm moving things around, I'm just gonna make sure my hands are clean. All right, so I'm gonna go ahead and open my gloves. Right, so I'm going to glove my dominant hand first. Okay, so I'm just gonna move this out of the way. All right, and then I'm gonna pull this back in view of the camera. All right, so now that I have applied my glove, I'm gonna go ahead and I'm gonna drape under the patient. Okay, Miss Brown, can you raise your hips up a little for me so I could put this under you? Okay, and then I'm going to apply the second drape to cover the perineal area. Okay, so now I'm gonna arrange my supplies on top of my kit. All right, so I have my cotton swab that's already open due to practice. I'm gonna lay them on top. I have my lubricant. I'm gonna open it. Now I'm gonna squeeze. I'm gonna discard. And then I have my syringe that contains 10 cc's of aquaflate. I'm gonna open my syringe. Okay, and then I am gonna attach my syringe, the tip to the balloon on the catheter. I'll just let it sit there for a while, and then I'm gonna go ahead. I'm gonna take this off, and then I'm gonna lubricate the tip of it 2 to 3 inches. Okay. All right, so now that I have done that, I am gonna explain. I'm gonna spread the labia open so I can visualize the meatus. Miss Brown, you're gonna feel me touching you again. Okay, so now that I have visualized the meatus, I'm gonna go ahead and I'm gonna clean you again, Miss Brown. So I'm gonna use my first swab, and then I'm gonna clean the side that's farthest away from me, from top to bottom. I'm gonna discard. I'm gonna take the second swab, and then I'm gonna clean the side closest to me, top to bottom, and then discard. I'm gonna take the third one. I'm gonna clean down the center of the meatus, and I am gonna discard. All right, so now that I've cleaned, I'm gonna take the lubricated Foley, and then I am gonna, Miss Brown, I'm gonna ask you to take a deep breath, and then you're gonna exhale, and then after you've exhaled, I'm gonna insert the Foley, okay? So take a deep breath. All right, so I'm gonna insert. Okay, so I have inserted, and I can see the flow of urine. So now that I've seen the flow of urine, I'm gonna advance for another 2 inches. Okay, so now I'm gonna take these 2 fingers of my non-dominant hand, and I'm gonna hold it right here so I could stabilize the catheter at the meatus. And then I'm gonna take this hand, and then I'm gonna inflate the balloon, ensuring that I use all 10 cc's of the aquaflate. Okay, so all 10 cc's is inflated in the balloon. So now I'm gonna remove the empty syringe. Okay. All right, so now I am gonna pull gently on the catheter until I feel some resistance. All right, so I'm sensing some resistance here, which means the balloon is properly inflated. So now I'm gonna go ahead, Miss Brown, and then I'm gonna clean you up, okay? Okay, so now that I've done all of that, I am gonna remove all the other stuff that I'm not gonna be using. Okay, and then I will discard all of those. All right, so Miss Brown, I am gonna attach the catheter to your inner thigh using a securement device. Okay, and then I'm gonna go ahead, I'm gonna hang it below you on the bed, and I'm gonna hang it in an area that is stable. It's not gonna be moving, okay? How are you feeling? Are you feeling okay? All right, so now that I've done this, I am gonna go ahead and I'm gonna remove my glove. Okay, and I'm gonna perform hand hygiene. All right, Miss Brown, I'm gonna put you back in a comfortable position. I'm gonna lower your head. No, I'm gonna raise your head, I'm sorry. And then I'm gonna lower the bed. I'm gonna go ahead and then I'm gonna cover you, okay? All right, so just a few instructions for the Foley, Miss Brown. If you're gonna get out the bed, try to ensure that you ring the call bell so someone could come and assist. Or if you're gonna move around in the bed, just make sure there's enough slack on the tubing. That way it doesn't pull when you're moving, okay? Whatever you're gonna do, just try to ensure that the tubing is not pulling, because we don't want it to get dislocated or we don't want it to cause any irritation to you, okay? Do you have any questions or any concerns for me? No? All right, so since there are no questions, I'm gonna go document, okay? So I'm gonna clean my hands. I'm gonna close the door behind me for privacy, and I'm gonna go document.